Good afternoon, Chamber members. Thanks for joining us again for a Chamber Conversation. Today's Chamber Conversation is with Delegate Karen Lewis Young. Delegate Lewis Young started her career and grew to great heights. And I got to know her when she was working her career in commercial banking and finance. She and I spent a year together in the Leadership Frederick County program back in 1998 when we were both teenagers. But since then, she's done some really interesting things. She served as a member of the Board of Aldermen for the city of Frederick from 2009 to 2013. And she was elected a member of the House of Delegates and has served since January of 2015 to the present time in that capacity. Karen serves on the Health and Government Operations Committee, which is the best policy committee to serve on in Annapolis. She is the recipient of numerous awards and recognitions for her public service career, and most importantly, for her issue advocacy in some areas that I think are really important because they speak to vulnerability and people who don't really have a voice. And when our elected officials serve as the voice of the voiceless, I think that's the highest and best use of the power of elected office. So it's in that context that I welcome and thank Delegate Karen Lewis Young for joining us today. So thank you, Delegate.
Well, thank you. Thank you for that splendid introduction.
So I'll follow you around if you need me to introduce you.
Yeah, do all my introductions.
So because I know you and I know the issues that really matter to you, it's easy to frame this conversation. So I'd like to dive right in and talk about how the global pandemic has impacted international economies and the national economy, regional economies, state and local economies. It's been incredibly traumatic, and I think we're just getting a feel of it now. Would you be willing to talk to our members about Maryland's revenue projections in the current year and maybe what you see kind of forecast going into the 2021 session?
Sure. Actually, Maryland is doing better than most and better than we originally feared. We will end the fiscal year 2020 on a positive note, and even 2021 is looking very favorable. Now, that's largely for two reasons. One is using some money from the rainy day fund, and the second is federal assistance. So 2022, we've got a challenge to face. Many people thought that revenues would be down because of income taxes. Actually, that is not where revenues are down. Revenues are down from sales taxes, and I'm sure that's something your members know all too well. So, since we have 2022 on the horizon, it gives us some time to plan ahead for that. Yep. And any specifics on that? I mean, where we're going to be the most challenged is obviously transportation issues, education issues. Those will be our greatest funding challenges. Now, something I do want to point out, because I've gotten a number of emails recently, and they're largely from business entities. And the email, which kind of looks like a standard email because they're all worded the same, says, please use the entire $151 million of the state budget for business incentives. Well, first of all, that's not the entire state budget. I think people are confusing that with the rainy day fund. And it is never wise to commit your entire rainy day fund. That would just bottom out our bond ratings for the state.
Oh, yeah.
as Rick, you well know, rainy day funds are for emergencies. And while certainly COVID-19 is an emergency and we have used some funds for that, it would not be prudent to invest them all. So yeah. I just wanted to say that for all the people writing me letters.
So I'm curious, and I'll dig in to try to figure out, I think some of this springs from an organization called NFIB, National Federation for Independent Business. So they've picked up on a call from Comptroller Francho to make targeted, immediate investments in business through, grants and low interest loans. And, maybe they've tied that to the rainy day fund. Frankly, the chamber would never advocate for that because I think it would be catastrophically bad public policy.
And you of all people understand the state budget well enough to know that that would be way outside of healthy guidelines. Actually, I will forward you a sample of the email so that you can get a sense of what it's all about, just in case it comes up to the chamber as an issue.
That's great. And what we'll do when we finish taping this, this will go up on our website, but we'll also do some show notes. So I think we can maybe clarify if there are members of the chamber that have been contacted by NFIB or some political action interest group, they can offer the thoughtful counter argument. So we'll definitely do that.
It's a great educational opportunity.
Sure. Well, speaking of that, speaking of teachable moments, right? The last 7 months, the disruption in our personal lives, in our families' lives, in our business lives, our work lives has been, I would describe it as profound, maybe historic, generationally historic. Studies have shown that stresses associated with COVID, and I mean writ large, all of the stresses, significantly increase the need for mental health services. You have been a tireless fighter for expanding access to mental health services. Can you talk about, the not just the COVID condition, the need that is out there, and how that's been expanded, increased by the effects of COVID?
Absolutely. Even before COVID, we were very challenged in providing adequate mental health services and funding. And even when resources are available, there is such a stigma that people are reluctant to ask questions to take advantage of it. The COVID pandemic has multiplied that 100-fold. People are suffering from isolation, loneliness, fear, and anxiety. And that is even worse among some of our most vulnerable populations. Seniors, people who are suffering from unemployment or worried about their financial resources, young people who really don't understand the magnitude of this and are concerned about their social environments and the way they learn and participate in sports. I was recently appointed to the Governor's Commission on Mental and Behavioral Health. And I think it was sometime back in May. So in order to get up the curve, I did a lot of research on what's happening, what's projecting. And what I have discovered is a mental health pandemic that could be as great, if not greater than the COVID pandemic for all the reasons I just mentioned. And of course, we all know that physical health is related to mental health, because if you're not feeling healthy, taking care of yourself and positive, your physical health is going to suffer. So it is going to be a great challenge to find the available resources to make sure they're properly funded and to make the connection of people who really could utilize those services. And of course, constantly try to break down that barrier of people feeling that Somehow it's a sign of weakness to ask for help and guidance.
Yeah, that's great. And in the context of the budget discussion that we were talking about, you know, what steps can you take to make sure that, you know, the appropriate level of priority is assigned to this? Because it is on some level a budget issue in terms of the access to resources.
It certainly is, and our resources are all very strained because early in the pandemic, they were not seeing business as usual. Their revenues were constrained, and so they were not able to invest in some of the populations that most need the resources during a time of crisis.
Is it also a health insurance issue in terms of access to mental health services?
Sometimes it is. That is improving quite a bit. Not to say we don't have a long way to go, but that is improving. I think that insurance gets it, that an investment up front pays off further down the road.
Yeah, that's great. You've been active since you were first elected to the House on the issue of prescription drug affordability and accessibility. Would you be willing to talk some about your policy achievements and what remains to be done in this area?
Yeah, I think more of my policy achievements have been with respect to opioid use and prevention, and in making sure that people have proper information about the risks and opportunities. Prescription drug affordability has been a real challenge. I actually have a couple of bills in. They were in last session. I think they would have moved, but because of the shortened session, they didn't. One passed in the House, not in the Senate. That made it possible for pharmacies to more effectively deliver some kind of drugs and treatments that previously they were not going to be able to. Also looking at the ability of some cancer treatments to come directly to your local pharmacy or your physician versus other sources. And so, you know, that looks at prescription drug affordability more through the distribution train. Other areas I have worked with are leading insurance companies on Lyme disease treatment, because there's a lot of mixed opinions about how long you should prescribe antibiotics for Lyme disease. And Lyme is very prevalent in Frederick County.
Yeah.
We have a prescription affordability board that's looking into best practices throughout the nation. And that's where we're trying to focus now, to try to take some of the best practices where we can pull all the stakeholders together and try to make some immediate impact.
Yeah, there's a lot of understandable civic outrage when people see, you know, pharmaceutical companies with huge profit based on drugs that they brought to market. And it's, you know, we've had access to hundreds of hours of briefings from both the industry and from the regulators that there certainly has to be the opportunity to produce profit from research and investigation. But when it crosses that line is when it's also marketing. And a pro golfer is telling you should go get Enbrel prescribed so that you can be a better golfer, and then you find out what Enbrel costs, you know, to be prescribed.
And there's no reason why a drug that you can get in Canada for $100 should be selling for $1,000 in the United States. And I know the large pharmaceutical companies have said that The reason that drugs are so high is because they're investing in research and clinical trials. However, as you said, when you start digging deep into the numbers and listening to the presentations, you realize that actually the federal government is funding a good deal of that research. So we need to come to some reasonable compromises. We need to give Medicare more power to negotiate for pricing.
Yeah, that's great. And evidence of what I know about you that maybe a lot of the people that have voted for you in your past don't know is that you are probably the deepest thinker in terms of research of anybody I've ever known in my time in Frederick County. So I remember when you were producing statistical information that was being used nationally by the financial services sector. And it's great to see you apply that to these complex health debates. But it's not just that. So it's that, and that's great. But it's also the personal and emotional side. So let's talk for a minute about another victim of COVID. And that's these families of senior citizens that are in nursing homes during COVID who simply can't do anything other than put their fingertips up against a window while a loved one outside puts their fingertips up against a window. And you know, we talked a lot about vulnerable populations. This is the most vulnerable population, and I know that's a concern. So would you talk about that for a few minutes?
Sure. And disclosure, I'm one of those families. My mother is in assisted living. She's been isolated now for 6 months. She is not healthy at all. So, you know, I don't know how much time she has. She doesn't understand the complexities of these policies. All she knows is she can't see her family. And so lots of other people have moms and grandmothers and grandfathers like my mom that are suffering from depression and isolation, and that is affecting their physical health. So I've been on a mission, and I've written all the committee chairs and the lieutenant governor and the Department of Health. And I don't know that it's my efforts, but hopefully it played some part. Last Friday, there was an announcement that we're going to start gradually opening up, which is good news because if restaurants can be at 75% capacity and in some counties we can play high school sports, we ought to be able to say hello to grandma someplace other than a porch visit or a window. However, once the governor says, okay, it's time, we need to get some guidance on best practices so that we can start implementing immediately. And from what I'm learning, you know, each long-term care facility is in the process of developing their own policies that look at CDC guidelines, their own concerns and constraints. And hopefully as the weather gets cold, which is happening very quickly now, we'll be able to see our seniors. But even when they're living in our homes, we have to take an extra level of precaution because of their vulnerability.
Yeah, absolutely. That's the reason I've been wearing a mask, even though I don't love wearing a mask. I have 2 elderly parents in their mid and late 80s, and I love them. And that's why I wear a mask.
And, you know, people think I'm a bit paranoid when I stop to chat with someone and I jump back about 3 feet and I just say, I got to take my 93-year-old mom to a doctor's appointment next week, and I don't want to do anything to put her at risk.
Right. Yeah, that's great. And it's human, and it's the right thing to do. So we've talked a little bit about health policy, and I know that's sort of your jam, and that's great. We need you there doing what you do. But are there other, in our last couple of minutes, are there other policy issues that you see kind of coming up on the radar screen? I know there was a veto of the Excellence in Education Act at the end of last session. There were some other policy vetoes that were related to the budget, and some other policy issues like police reform that I know are going to be on your radar. Can you talk about some of those things?
I mean, absolutely, police reform's going to be on our radar. As you know, I don't sit on the Judiciary Committee, but I'm certainly paying attention to that. I have a lot of questions I'll ask. I think on an ongoing basis, the populations that are most affected by the COVID pandemic, those that are out of work, those that can't pay their rent. And by the way, the statistics that I saw from Maryland just yesterday were those people that are in unemployment are the lowest wage earners. So those are the people that probably didn't have savings to begin with. So Governor made an announcement today about allocating more funds towards legal assistance for rent evictions. That's going to be a big topic. And of course, what can we do to help small business? And I have a particular focus on small business during this pandemic. What can we do to make sure that they have access to creative thinking, innovation, and financial resources? And of course, the way we started our conversation, relooking the budget, because before we vote, or at least before I vote on, the veto for education, I want to see a reforecast of the financial numbers, because as you said, I rely on data to make my decisions.
Yeah, well, you do a fantastic job.
Thank you.
And part of it is I'm colored by the fact that we have this sort of shared history. And right. So, the policy stuff, as well as our time together at the city of Frederick and everything. So,
yeah. Well, I will say, particularly since we're speaking to a business audience, my business experience has just been invaluable for me. Spending 30 years in financial services and always having the expectation of doing my homework, making sure my presentations were buttoned up, that they were financially sensible. I mean, that's the lens I look at policy too. And I once said to former Speaker Michael Bush, after about 6 months on health and government operations, I said to him, I always wondered why you put me on a policy committee and not one of the budget or finance committees. But now I see that you have to have somebody on those kind of committees asking what cost and what do we get for that cost? And he just looked at me with that little wink in his eye and said, oh, I knew exactly what I was doing.
Yeah, Coach always did know what he was doing, for all of us that served under his influence. Yeah. Well, listen, I really want to thank you for taking time with us. I look forward to talking to you again. If during the session, it can be a little bit more hybrid, I promise you I'll come down with a video camera so we can do a follow-up. And if not, we'll look forward to talking to you after session. Chamber members, if you have a question, please email Delegate Lewis Young. Will include her email with the show notes for this video. She is incredibly responsive and she has a great team with her, and she'll get right back to you if you have a question. So be sure to follow up. Karen, thank you again.
My pleasure. Thank you for having me on today.
It's great talking to you.
Nice speaking with you too.
Bye.